Hi, everyone. We'd like to welcome you to this Q&A session with the Big Sky Care Connect team. We have, I guess, almost everyone on our team here in the chat room, so we are anxious to see what questions you have for us and to answer them as completely as we can for you. We do have another slide to go over. It was kind of part of the closing remarks. Haley, can you bring up that slide that has the housekeeping stuff on it? Do you mind? We may not have Haley here yet, but we'll get to that in just a moment. We just wanted to remind everyone that the recordings from the sessions today will be made available and that we're going to send out a survey, a link to a survey, and we would like you guys to tell us how we did today, how we can improve in the future. It'll just take 2 or 3 minutes for you to answer those questions, but it'll really help us out for the future with that. I will see if I can find that, and I will turn it over to you guys to see what questions you have for us, and then we will get to that slide a little bit later. Jeanette, do you want to introduce some of the team members while we're waiting to see if people have questions?
Well, sure. I'm Jeanette Polacek, and I am one of the team leads from Health Tech Solutions. I run the outreach team, onboarding team, do a lot of marketing, help with the planning of events and this conference. So it's been really great to see everybody here. And thank you for the participation. I think we had some really good stories today. Kurt, you want to introduce yourself?
Sure, thanks, Jeanette. I'm Kurt Swenson with FutureSync International. We're a Montana-based organizational development consulting firm. We're partnering with Big Sky Care Connect to help with outreach activities, and primarily we spend our time working with participants to provide them with change management consulting services, whether that be training or planning services, as they onboard with Big Sky Care Connect.
Haley, go ahead.
All right, I am an outreach coordinator and I also help with the communications. So I am playing both roles for the team for Big Sky Care Connect.
And Paul.
Good afternoon, everyone, and thank you for your participation. Paul Peterson, Sisyphus Consulting. I am working with the Big Sky Care Connect team, primarily on the outreach efforts.
Young, go ahead.
Good afternoon. My name is Young Huff, and I am one of the outreach coordinators working at Big Sky Care Connect.
And Stephanie.
Good afternoon. I'm Stephanie Sullivan. I live in Billings, Montana. Thank you for being here today, and I'm one of the outreach coordinators with Big Sky Care Connect.
And finally, Drew.
Hi, good afternoon, everyone. I'm Drew Hensel. I serve as the program manager for the Big Sky Care Connect project. And just want to also pass along my thanks to everyone for their attendance today.
I think I got everybody, Kelly.
I forgot to introduce myself. I'm sorry.
Say, except for Kelly, yeah.
My name is Kelly McDermott. I am the training lead on the project, and also I work with communications and just work with the whole team in general to make sure that everything goes smoothly and everybody knows what they need to know. Go ahead, Jeanette.
All right, so do we have any questions? I see a couple of people here that were on, that were presenters, but I see a couple of you that are not. So did you guys have questions for us?
Hi, I do have a question.
Oh, could you speak up a little bit?
Sorry. I'm a new so I really have more to listen to the questions. But I am interested in what is the average time frame that when an outreach coordinator develops a relationship with contact with a potential subscriber by their group until it goes live, that our services go live?
All right, I guess I'll take that one. So I think you asked, I was having a hard time hearing you, but I think you asked about the average time from when we first start the relationship to go live for a participant.
Yes, that's correct. Sorry,
Yeah.
I don't know what my assumption was.
All right, it's okay. Well, it is a highly variable process. A lot of factors come into play. You know, the first piece is from an organizational perspective, the level of awareness of an HIE. You know, what is it? Do I already understand the value and how it's going to benefit me or my organization? If you have that sort of understanding, we can skip a lot of the first part and get right to the signing. Then from the signing point, it's really dependent on the level of support the organization has in terms of their own IT resources, their technical resources, as well as the resources from the EMR vendor. In an ideal world, the implementation from the time of signing to when the go live happens can be a 8 to 12 week process. I will tell you though that has not been our experience to date. And it's I mean, we're also in the middle of a pandemic, so we have that to start with. And so resources are strapped, but we do have, I think, on the order of about, I'm going to say 7 or 8 different organizations that we're now actively working on interfaces in one way or another. Young, is that about right? 6 or 7?
I think we actually have more than that. I think there's like
more?
9 or 10 maybe. Yeah.
Yeah, at various stages. And we have several, including Medicaid, where we're getting very close to being able to, we're in the final stages of data validation on those pieces. So, and I think that will get better as we go along. We'll have more experience with EMR vendors, you know, and we can put pieces in place along the way that it makes it easier for those that come later for it to be a smoother process. Anyone else have any questions?
While we're waiting on that, Haley's going to go ahead and share the slide since we finally found it. Yay. There's just a little bit of information here for everyone. Of course, I said the surveys will go out by email. There will be a link. Swag bags, those will be mailed out through the Postal Service, so be on the lookout for those. Conference recordings will be made available on the conference page. We will get you that link if you need it. If you missed the ED alerts, we are holding a webinar series, so please join us for that. We also have recordings of some other webinars that we have done that are available. If you're interested in that, reach out to us. We'd be happy to get you the links to those. This series on the ED alerts, the first one will be held Wednesday, November 7th at 7:30 a.m. Mountain Time. Registration information will go out shortly for that. And then also our contact information is here. We want you to become a BSCC participant. We need your information. Montana needs your information in the system to just make it more robust for everyone. So we would really like to talk to you about becoming a participant. So please reach out to us so that we can do that. And I will turn it back over to you guys with questions.
Kelly, Paul, on the notice for the hospitals, it says Wednesday, November 9th. Do we mean Wednesday, November 11th? Or Monday,
Yes.
November 9th?
It is Wednesday, the 11th.
It is the 11th. I apologize for that. Yes.
Wait,
Thank you, Paul. Thank you for catching that.
Well, because I was thinking, wait a minute.
Good catch.
win the prize, Paul.
What's that?
You win the prize for finding the error in the slide.
So
Great.
make sure you're paying attention.
Do I get a swag bag?
For those of you interested in learning more about Big Sky Care Connect, I'm an outreach coordinator. Also, Haley is an outreach coordinator, and Young as well. And so you could reach out to any of us, or even just the website, and just say you want information, and we'll make sure you get information. You'll get in contact with one of us. And then from there, we reach out to you either by phone or by email, depending on your preference on what you give us, how you'd like to be contacted. And then we look for a time to set up just a discussion. We want to know why you're interested in Big Sky Care Connect, and then that will help us help you basically determine the needs of connection. You know, how could Big Sky Care Connect meet the needs of your facility, your hospital, your clinic, or whatever you have? We're here to help, and there's so much just value in this HIE. And it can help our providers and our patients. So reaching out to us, we can show you exactly how it can help your organization. From there, we could set up a presentation if you like. It could be just with you, it could be with your leadership. And then we discuss partnership, what that looks like, how Big Sky Care Connect can meet your needs. And then we continue to follow up with you until you're ready and have all your questions answered. And so we're here every step of the way. We have constant contact either through your preference, how often you want contact, also for, you know, phone calls and emails. And so just reach out to us and we're happy to help.
All right, well, if you don't have any questions, then I guess we're done. Thank you guys again so much for joining us. We really appreciate all your support, and we look forward to further discussions with all of you on becoming Big Sky Care Connect participants.